Good day, this is Anne of Reinforce Me Club. Today we're going to talk about why does type 2 diabetes ever occur? In spite of the crisis going on around the world, let's just dive into this type 2 diabetes. Let me walk you through. Now, first things first. Whenever someone develops a certain type of disease, there is what we call predisposing factors and precipitating factors. When I say predisposing factors, it means that a person is susceptible or prone to developing this certain certain kind of disease. When I say precipitating factors, it means that there is something going on in the body of a person which leads him or her to develop a certain kind of disease, which like type 2 diabetes. Now, talking about the predisposing factors of type 2 diabetes, the number one is just merely being overweight or obese. It's the main risk above all. So I have here the body mass index guideline, which tells you more about your BMI. You can just calculate your BMI by just knowing your weight in kilogram divided by your height in meter squared. So when you are underweight, it means that you have 18.5 below. When you are normal, it is within the range between 18.5 to 24.9. When you are overweight, it is in between 25 and 29.9. When you are in the obese level, you are 30 and above. Now, another thing which makes you susceptible to type 2 diabetes is your fat distribution. So when you mainly store fats in the abdomen rather than in the hips and thighs, it indicates a greater risk because in the abdomen, there is what we call adipose tissue. That is good. It makes you it gives you a little bit of belly. But when your diet is too unhealthy and in the long run, your body still store a lot of fats, it will turn out into what we call visceral fats. Visceral fats actually get stored under the adipose tissue. It can also accumulated in the internal organs near the liver and intestine, and it produces substances which alters the utilization of insulin. And as a result of that, you could be prone to what we call this insulin resistant condition. Now, another factor is lack of physical activity. So I just write it down, inactivity, but it's actually lack of physical activity. Completely sedentary lifestyle. Eating and not having this what we call active body. Just consuming, and no movement at all. So in that condition, in that scenario, you have too much glucose in the body and you're not using it. Simple as that. Another thing is family history. So type 2 diabetes isn't a genetic problem. When I say family history, when your mom or your dad or your sister is diabetic, it means that there is high probability that you share the same lifestyle and habits. So that makes you prone to developing type 2 diabetes. And another interesting thing that I found in the internet is the race and ethnicity. I found it in mayoclinic.org. So Black, Hispanic, Native American, Asian people, and Pacific Islanders are more likely to develop type 2 diabetes. So I'd say Asian, could be not in general. We don't really prioritize working out because we keep working for money. And the best part of it is that our food is absolutely delicious. We eat to live. If other people live to eat, we eat to live. Absolutely. Another thing which makes you prone to developing type 2 diabetes is you have high cholesterol level, particularly this LDL, low density lipids. These are bad cholesterol. When you accumulate too much cholesterol inside the body, it could clog up the main veins or arteries in the body, which can result to another cardiovascular or another disease again. And age. Type 2 diabetic people tend to be 35 and above. And also, when you are pre-diabetic, this pre-diabetic condition means that your HbA1c, your FBS, your fasting blood sugar, your oral blood glucose test is in the what we call borderline level. So just When you add up another 1 point or point couple of decimal points, you are already in the diabetic level. So pre-diabetic is just within the borderline. And there are also drugs which increases the blood sugar level in the body. Some of them are statins, antidepressants, the Zoloft and Cymbalta, thiazide diuretics. These are water tablets, and amiodarone. So this makes you prone to developing type 2 diabetes. Now, let me walk you through the precipitating factors. Number one is the insulin resistant condition. So this is what's going to happen here. So in the type 2 diabetes, in a healthy human being, once the person eats, the stomach converts it into glucose. And then in response to that, the pancreas, particularly the beta cells, secretes insulin. And once the insulin is released in the bloodstream, hanging out with the glucose there, this insulin dives into the cells and opens up the insulin receptors, which makes so that the glucose in the bloodstream can go into the cell so that the cell can utilize the glucose. And then what will be the job of the cell then? They're gonna bring this glucose to liver so that it can be stored as glycogen. And some of the cells will go to the muscles so it can be used, in case of emergency, when we're in stress. And some cells would convert this into fats. So that's why we have it, in the belly. We have some fats in our hips and thighs. So in the case of type 2 diabetes, because of, let's say, too much eating, so too much glucose in the bloodstream, and in the long run, the beta cells in the pancreas will do its best to compensate the too much glucose in the bloodstream up to the point that the beta cells are damaged. There's just too much glucose. I can't take this job anymore. So as a result of that, your body becomes insulin resistant. So what's going to happen to the glucose? The glucose will just stay in the bloodstream unused, and you're going to develop signs and symptoms for that from different organs. So that's what happens to type 2 diabetes. So this is step one. Now, another precipitating factor is the PCOS, the women with polycystic ovarian syndrome. So women who have PCOS, they actually secrete insulin. It's just that their body is resistant to it. So that's why in the long run, they develop type 2 diabetes. And for those moms who experience gestational diabetes, they're also prone to developing type 2 diabetes when they get old. And in the most part, you will be prone to develop type 2 diabetes if you have some sort of endocrine problems, like any diseases which affects your endocrine system, because endocrine system regulates the homeostasis of the body by secreting hormones. So that's why if you have any problems which affects the endocrine system, in some point you have high probability of developing type 2 diabetes, like pancreatic disorder or pancreas tumor. So when you have pancreatic tumor, it is where the beta, the delta, and the somatostatin hormones are being released. So when you have tumors or disorders in pancreas, that's a big problem. So you're going to develop type 2 diabetes, including Cushing syndromes and other endocrine disorders. Now, so what's going to happen when you have type 2 diabetes? So let's dive into the symptoms. Now, the kidney will compensate because the kidney is being damaged because of the release of glucose, the sugar in the kidney, and it's hard work for kidney. So as the result for that, you are going to develop excessive urination. Now, by the way, there are three main symptoms of type 2 diabetes. This is what we call the 3 Ps. This is medical terms. Polyuria, which is excessive urination. Polydipsia, increased thirst. Because of too much urination, the kidney compensates and you become dehydrated. You drink a lot of water. And polyphagia, which is, in other words, increased hunger. That is sugar craving. Because the sugar is not being utilized by the cells, you're still hungry. It's not being used by the muscles, you're still hungry. And you also feel tired, drowsy, and you're gonna develop some kind of bladder infections because of too much sugar in the body, tingling or numbness in the extremities, poor wound healing, unintentional weight loss. So when you feel that there is really something going on in your body, you feel sick and it's not normal anymore, better consult your doctor. And what will the doctor take? He's going to take your HbA1c level, your random blood sugar level, and sometimes they need the oral glucose tolerance test. Other than that, they're going to investigate other cause of your signs and symptoms. It could be type 2 diabetic, or it could be something else. Thorough investigation and assessment. Now, so what will be your level if you are diabetic in terms of HbA1c, fasting blood sugar, and oral glucose tolerance? Now, for the HbA1c of the normal people, they have below 39 millimole. For the pre-diabetics, it's between 39 and 47 millimole. And for diabetic people, diabetic patients, it's equal and above 48 millimole. Talking about the fasting blood sugar tests, for normal people, it is below 5.6 millimole. For pre-diabetics, it's between the range of 5.6 to 6.9 millimole. And for diabetic patients, it's equal or above 7 millimole. And for the oral glucose tolerance test, for normal people, it is below 7.8 millimole. For pre-diabetics, it's between 7.8 and 11 millimole. And for diabetic patients, it's above 11.1 millimole. Equal and above 11.1 millimole. Now, what's next? So what's going to happen then when I have diabetes type 2? Now, healthcare professionals have top three management to that. The number one, the most practical and economical, is lifestyle modification. It means that you have to eat healthy and exercise. The second option is oral hypoglycemic, and lastly, insulin. Depending on the status of your type 2 diabetes, when you happen to find it out, when it's not really worse, you might just the doctor might just help you consider lifestyle modification. And, if it's necessary, they might go into prescribe you with oral hypoglycemics plus insulin or just oral hypoglycemics. But regardless of your status, by the time that you happen to find out that you have type 2 diabetes, even if it's worse, the most life-changing thing that you could ever do is lifestyle modification. Now, let me explain. When you take control of your health, you change your life, you change your bad habits, in the long run, the doctor might take out the insulin. And as time went by, if your blood glucose level is still in the normal range, they might going to take out the oral hypoglycemic. And as a result of that, you are totally in control because you can discipline yourself. And your blood sugar level will give you the best feedback ever. And always remember that type 2 diabetes is manageable. So whatever you have right now, it's a good start. If you've been diagnosed with type 2 diabetes, it's a life-changing thing that ever happened to you. It means that life is telling you to take control of your health because it's your responsibility, and whatever you do to your body leads you to the future that you want, leads you to your dream. So this is Anne once again of Reinforce Me Club telling you, live, learn, and repeat. Have a lovely day.